Hello, everyone. Today, I want to briefly discuss a pretty important concept in healthcare system. It's called decentralization in healthcare. And let me explain why it matters to both the healthcare organizations and the communities that we serve. Decentralization in healthcare refers to shifting decision-making authority, resources, and also responsibilities away from a central national government and distributing them through regional, state, or local healthcare organizations. Instead of all healthcare decisions being made at the top level, local healthcare systems and providers have greater flexibility to manage services based on the specific needs of their communities. There are several different types of decentralization. An administrative decentralization involves transferring operational responsibilities to the local healthcare agencies or hospitals. Fiscal decentralization, on the other hand, allows local governments or healthcare organizations to control portions of healthcare funding and budgeting. In addition, political decentralization gives local authorities more influence over healthcare policy decisions. And together, these different approaches aim to make healthcare systems more responsive and efficient. There's one major advantage of decentralized healthcare, and it is the local communities that often understand their own healthcare needs better than a centralized authority. For example, rural communities may prioritize primary care access and telehealth services, while urban areas may focus more on emergency services and specialty care. Decentralization also allows healthcare leaders to tailor services to local populations and improve patient-centered care. Another benefit is increased flexibility and faster decision-making. Local healthcare organizations can often respond more quickly to public health concerns, staffing shortages, and also changes in patient demand without waiting for approval from a national agency. Decentralized systems may also encourage innovation because local governments can test new healthcare delivery models and technologies. However, decentralization comes with certain challenges. One concern is inconsistency in healthcare quality and funding between regions. Wealthier communities may have better healthcare infrastructure and resources than the underserved area. Coordination between healthcare systems can also become more difficult when responsibilities are spread across multiple organizations. And because of this, governments still play a very important role in establishing national healthcare standards, regulations, and also equity goals. As healthcare professionals, understanding decentralization help us better understand how healthcare policies affect our daily operations and also affects based on outcomes, budgeting, and resource allocation. It highlights the importance of collaboration between healthcare organizations, local governments, and community stakeholders. For anyone interested in learning more about this topic, I recommend reading the World Health Organization, WHO's article titled Decentralization in Healthcare and Health System Governance. It provides an excellent overview of how decentralized healthcare systems operate globally and discusses both the benefits and challenges of this healthcare model. Thank you, everyone, for your time, and I hope this overview helped you better understand the role that decentralization plays in modern healthcare systems.